And every class um, is going to be recorded. So our very first topic for the CMAA exam is going to be scheduling. And who remembers how many questions we have for scheduling? Did anybody take notes? 19, that is correct. So 19 questions on scheduling. So if you are taking notes, the first thing I want you to know as it relates to scheduling, there are 5 areas that you want to ensure that you understand and can answer questions about. So the first is the different types of patient scheduling, determining scheduling needs, following appointment protocols, arranging diagnostic tests, and then confirming future appointments. Now, you may be thinking, wow, this seems like a lot for scheduling, but you have to remember healthcare is a business, right? And in order for the business to stay in place, we have to have certain rules and regulations. So when we talk about scheduling, I know this picture is kind of hard for you to see, but this is actually a computerized scheduling system. And this is what we have today, which everybody loves because, and I'll use myself as an example, I have an appointment with my doctor in March of next year. And my doctor called me and said, or the office called me and said, hey, the doctor won't be available on that day, so we need to move you to a different day. And so when I called them up, they have a computerized scheduling system, and what they were able to do was tell me what slots were available. So again, even though you can't see the screen here, at the top there's some pictures of 3 people, and those are the 3 doctors that work in this practice. Oftentimes, practices have multiple doctors that are working. Some work in the afternoon, some work in the morning. And so what happens is that when patients are scheduled, they're scheduled under a particular provider. Or some offices have what's known as a walk-up clinic, walk-in clinic. And with those walk-in clinics, walk-up clinics, patients are just added to the schedule. But what you're seeing here is when we're actually scheduling that patient for an appointment via the computer. Now, the one thing I want you to know about the CMAA exam, if you have worked in healthcare before, I kind of want you to put that knowledge to the side, and you may say, why? Well, with the CMAA exam, the information that they are expecting you to know may be different than what you have experienced either as a patient or what you have experienced while working at a healthcare facility. So I want you to keep that in the back of your mind, because one of you is going to say, well, wait a minute. Where I worked, we didn't do it that way. So I want you to understand, for the CMAA exam, you got to do things the way that is covered in your book. If you try to bring in something that you did in a previous job, you may be setting yourself up for failure. So this is a computer system. And then, believe it or not, we still have some offices that have a book schedule. So yes, on the CMAA exam, you are expected to know that we can schedule patients by a book, but we can also schedule patients by a computer. So one of the things that you're expected to know is, what are the advantages and disadvantages of a paper schedule versus a computer schedule? Well, I don't know about you, but Computer schedule is definitely a lot more flexible in terms of being able to move patients from one slot to the next. In a paper schedule, like this book that you're seeing here, we usually use a pencil, and then we have to erase a patient from one slot and then move them over to another slot. And that could be pretty challenging because what if someone doesn't have good penmanship? And so if you're trying to add that person's name in that one slot and you've erased that slot, it could be pretty challenging. But the bottom line is, for the CMAA exam, the Certified Medical Administrative Assistant, you must understand scheduling. Now, coincidentally, and I want to make sure that you guys understand this, even though you're taking the Certified Medical Administrative Assistant exam, that may not necessarily be the job title that you're going to see at your organization. The job title could be patient registration, patient access specialist. What you really want to look at are the duties of that job, because that's what you want to apply for when you are applying. All right, now we are going to go into what is known as the type of booking. Booking is a word that means scheduling. Now, here in Chicago, I realized that when I was very young, I participated in one of these scheduling types of processes. And let me explain. So first up, for purposes of the CMAA exam, you will need to know that there are 6 types of scheduling. The first is called wave booking. And with wave booking, patients are scheduled at the same time each hour. So here's my personal story. Here in Chicago, we have a hospital called Stroger. Back in the day, it used to be called Cook County Hospital. Cook County Hospital had a clinic, and the clinic was called the Fantas Clinic. And at the Fantas Clinic, everybody would basically have a 9 o'clock appointment. And so what we learned pretty quickly was, don't come at 9 o'clock, come like at 7 o'clock or 6 o'clock, because you are going to be taken in the order that you are seeing. So with wave booking, patients are coming at the same time each hour. So I'll give a perfect example. So Monday night, I got my COVID booster. And I went in to schedule myself. And then my husband was like, well, I need to go. So I scheduled myself for 5 o'clock. And then when I went back in, I was able to schedule him for 5 o'clock. Then I went back in and I was scheduling my mother-in-law again for 5 o'clock. We all had a 5 o'clock appointment. And so basically we were seen in the order that we arrived. So wave booking, patients are told to come at the same time each hour. So like 9, 10, 11. Modified wave is similar, but a different variation. So with modified wave, you can have 2 patients that come at 9 and then 1 patient that comes at 9:30. And the goal is, some people are going to be on time, some people are going to be late, but the goal is that we are creating this short-term flexibility in that those who come late, we'll get them in, and then hopefully by the next hour, those patients that were on the schedule are gone. Now, let's just be real. If you tell 7 people to come for an appointment at 9 o'clock, you kind of are working in a state where you're running behind. And that's what I remember from Cook County Hospital. Okay, so that's modified wave booking. Double booking is something that we try to avoid. Double booking is where you book 2 people at the same time. So 2 people have a 9 o'clock appointment. Generally, when we do double booking, we want to ask the physician if it is okay. Or we refer to our organizational policy with regards to if this is okay, because essentially that doctor needs to be trying to see both of those patients within that time frame. But the same concept applies. You know, whoever gets there first is usually who is seen first. So why would we double book someone? Well, think about, you know, you got your regular schedule, and let's say you have a patient who needs to be seen urgently, but it's a minor problem. You kind of work them into the schedule. Or you have a situation where the patient was released from the hospital. They need to come in and follow up. So we kind of slide them into the schedule. And so they're double booked. But the key with double booking, it's the same provider scheduled to see more than one patient at the same time. That's so important. It has to be that one doctor is going to be seeing like two patients, okay? Next up is stream time specific scheduling. Now, with stream time specific scheduling, this is the regular way that we schedule, right? Patients are coming in at regular intervals, whether it be 9, 9:15, 9:30, 9:45. And with stream time specific scheduling, every organization has a policy that dictates how we're scheduling. So maybe established patients every 15 minutes, new patients, a 30-minute slot. But the one thing I want to tell you, and you probably are thinking, oh my God, this is on this exam. Yes, on the CMAA exam, you already know you're going to have 19 questions on scheduling. And they expect you to look at a scenario and say, oh, this patient is wave booking. This patient is modified wave booking. Okay, so stream time specific scheduling, that's just the way that we normally schedule. Then we have open booking. Open booking is like, think about a sexually transmitted disease clinic where the schedule is just open and you can just come in. And again, patients are seen in the order that they arrive. You also can think of this like urgent care, where again, there's no slots, you just come in. Some clinics here in Chicago and everywhere have walk-in clinics where you just walk in, maybe you got an upper respiratory infection and you just need some antibiotics and all of that. So that's open booking. And then last but not least, cluster or categorization booking is when patients are grouped together in clusters based on what they're coming for. So one example could be patients are coming into the office for a minor procedure. Well, if we're going to be using equipment for this procedure, and that's what we're going to be doing that day, let's say we're going to be doing, we work for OB-GYN, and we're going to be doing like some gynecological procedures. Well, we want to have those patients grouped together so that we could have that mindset, the equipment, that's what we're dealing with at this time. And so that way, from the perspective of resources and equipment, everything is grouped together. Another example, this when I worked as a medical assistant, this was like hump time. Physical exams, when kids need the physical exams for their, they got to go to school, we would schedule them all on the same day because we want to make sure that we have all of our forms and all of our vaccinations and everything ready to rock and roll. All right, so these are the 6 types of booking that you are expected to know for the Certified Medical Administrative Assistant exam. You're going to hear me say this over and over and over again because remember, your end game is you want to become a Certified Medical Administrative Assistant today. Don't forget, healthcare has so many opportunities today. Certified Medical Administrative Assistant. Maybe later, medical coder or medical biller. I personally started off in healthcare as a medical assistant and essentially was forced into medical coding, medical billing, documentation improvement, auditing, all of that. And that's really what helped me be so versatile in the healthcare space, because I didn't know how to do one thing. All right, so when we talk about scheduling, the next thing that we have to consider is scheduling needs. We have to consider the needs of our patients, right? So, is it a new patient appointment? Is it an established patient appointment? Does the patient need the first available appointment? Do they need an appointment 3 months from now? Also, and really, this is really getting into some of the day to day. You're going to hear me talk about things that happen day to day in the medical office, because I don't want you to just know like textbook what we do in the medical office. I want you to really, really, really understand the real world perspective. So in the medical office, we have all of these policies and procedures with regards to how long a patient should have an appointment. But sometimes you have appointments with patients where you'll see in the system, it'll say, must schedule the patient for 2 time slots. So maybe normally an established patient is 15 minutes, but this particular patient, you have to schedule for 2 time slots because they got a lot of complex problems, and so they need that particular length of time. The other thing about patient needs, sometimes patients will say, I don't want to see Dr. Smith, for example. In some offices, they schedule you with the person that you normally see, but maybe if that person is not there, maybe they'll put you in with someone else. And so we have certain patients that will say, oh no, don't put me in with such and such. And so that will be in our system, and we'll know once we open up that patient. All right. We also, from a patient need perspective, we want to think about, and I just took my mom to the doctor on Monday morning, and the doctor's office that she goes to is all senior citizens, everybody that is 65 and older. I thought that was a great concept, because when you're 65 and older and you're going to a doctor's office appointment, you don't necessarily want to be in the doctor's office with the little babies. And so that clinic had that concept. But if you work in a clinic and they don't have that setup, what you really want to think about is, okay, do we schedule our babies in the morning? Is it that our moms or dads need to bring the babies in the evening? Is it a situation where moms and dads can only come on the weekends? You really want to consider your patient's needs, because that's what's going to impact how you schedule your patients. So for me, I am obviously a healthcare professional, very busy. So for me, I want that first slot in the morning. I don't want to be in a situation where I have to wait, sit in the waiting room and wait, because usually when I go there, I have somewhere else that I need to go, at the same time. Okay. Also considering our patient's needs. Is your patient on public transportation? Is your patient on, here in Chicago, we have like the, what do they call it? Medical transportation. So is your patient in one of those situations where they need to come a certain time of the day, so that their ride can pick them up and drop them back off? So those are all patient needs. Okay, our providers. I mentioned a few minutes ago that my physician office called me and said, hey, you got an appointment in March, but your doctor is not going to be available, so we need to switch you to another day. When we set up our systems, we always block off when our doctors are not going to be available. So it could be that you work with Dr. Smith and he does not see patients on Mondays and Fridays. So in the scheduling system, we block off Dr. Smith for Mondays, we block off Dr. Smith for Fridays because we don't want any patients to accidentally get on the schedule. If you work with a surgeon, maybe the surgeon is in the operating room on Tuesdays and Thursdays. So you want to make sure that that person's schedule is blocked. We talked about cluster scheduling. So maybe your doctor only does the gynecological procedures on Tuesdays. So in our system, when we are setting up how we want our patients to be scheduled, maybe we say this slot is procedure, this slot is new patient, this slot is established patient, this slot is vaccination only. So that way we are maximizing the time that we are spending with our patient. All right, the other scheduling need that we need to take into consideration, the facility. So remember I said that maybe for pediatrics, sometimes the parents need to come at night. Well, if your office isn't open at night, you can't schedule patients at night. When the office is open, there are certain needs that have to be met, right? We need to make sure in this day and age, we got security that's there. We have to make sure that we have our nurse or our medical assistant that's there. So we want to make sure that there's nothing going on in the facility. So for example, I was at the airport, and it's not a hospital, but I just want to show you this example. I was at the airport and I was going to my car. I had come back from a late night flight. And in the parking lot, I saw all of these construction cars. And I'm like, what's all these construction cars? Then it dawned on me. The airport was going to be, this was Midway Airport. The airport was going to be closing down. And so the construction workers were coming in as the airport was shutting down. Because I don't know about you, I don't want to be anywhere where there's construction workers that are all over the place. And so that made sense. So we have to consider the needs of our facility. Also, and we're going to get into this as we get into the different areas. If we have a situation where there's going to be some testing on a system, fire alarm system, or whatever the case may be, we want to make sure we are aware of that. And one thing I want to mention about providers. Our providers, they have needs that we want to make sure that we meet. So for example, there are some doctors who will say, 4 o'clock is my cutoff. Don't schedule me after 4 o'clock because I got to pick up my kids from school, whatever the case may be. So you have to ensure that you are in tune to the needs of all three of these people. So patients, providers, and facility. So again, don't forget, CMAA exam, we're talking about scheduling. There are 19 questions on scheduling. So now we're going to talk about appointment protocols. And every organization has their own specific appointment protocols. And this is important because you don't want to not be in compliance with whatever their rules and regulations are. So late patients. Even though this is the first day of your CMAA training, one thing I want you to know about healthcare is that time is money. Every patient that we put into a slot results in a claim form that's going to be generated. And we'll talk about that in a different session, not today. Right now, we're just talking about scheduling. And so if a patient is late or doesn't show up, that potentially is a slot that we could have put somebody else in. So for late patients, now you are going to figure out which of those patients that are chronically late. So number one, when they first book their appointment, we must tell them, if you are more than 15 minutes late, we either will not see you, may not be able to see you, but patients need to know, because we have some people who are unfortunately just, they're always late. So you need to let them know what your policy is. All right, emergency situations. Now, we can see patients in an emergency situation if applicable. And this is important because if someone calls you and says, "Hi, I want to make an appointment with Dr. Smith for today. I can't breathe." Well, we're in the medical office. You need to tell the patient to call 911 or go to their nearest emergency room, as opposed to trying to come to our office, because if they can't breathe, there's not a whole lot we can do for them in our medical office setting. So we really want them to go to urgent care, all of that. A little while ago, we talked about open booking, double booking. And so for emergency situations, you need to know, how do we handle those circumstances? Can we double book them? Do we have a walk-up clinic that the patient can go to? That way they're able to be seen for today. But we need to know what our policies are. All right, patients without appointments. When they call us, you must ensure that you know what your policy is. So if it's an established patient, we want to triage the patient and find out, what exactly is the need. Is this a situation where we can get doc on the phone, they can chat with the patient and call in a prescription, or do they need to come in? Now, a new patient without an appointment, that is tricky, because why? If they're new, we don't know them. We don't have their history to be able to look at and work with the patient today. So your policy is going to dictate how you handle the patients without appointments that are new, because usually a new patient, that could be anywhere from 30, 45, 60 minutes, depending on the patient's problem. And if you got other patients that are in the waiting room, you got to think about those patients that are in the waiting room, because I don't know about you, I'm just going to tell you about me. I'm busy. And when I go to the doctor's office, I'm not trying to sit there for 5 hours, because they're sliding people in and out, okay? All right. Canceled appointments. I don't know if you guys have experienced this, but this I have experienced personally. My father was admitted to the hospital, and he had a cardiology appointment. When we called to cancel the appointment, it was less than 24 hours before the appointment. And they said to me over the phone, because it is less than 24 hours before your appointment, you will need to pay a $200 cancellation fee. Whoa! I was like, what? So the first thing you may be thinking, why are they charging somebody that dollar amount to cancel an appointment? So again, this is just day one of your certified medical administrative assistant program. But let me just be very clear. Every patient in a time slot potentially is going to result in a claim form that's submitted to the insurance company. A claim form is like a time card. You go to work every day. At the end of the 40 hours, or at the end of the time period, you're going to submit your time card and you're going to get paid. Well, every patient that we see, in most circumstances, and there's all of these different rules and regulations that we're not going to get in today, but we're just going to say everybody that's on our schedule for today, they are going to result in a claim form that's submitted to the insurance company. The claim form is like a time card that says, hey, Dr. Smith saw Mrs. Jones on XYZ day. We did an office visit. We drew some blood. Please pay us for that service. Now, the difference with medical claims, when you go to work, you get paid every week, every other week. Some people get paid once a month. Whereas with the doctor, it can be weeks before they get paid for seeing that patient. But guess who they have to pay? You, because you're the one that's scheduling the patient. You're the one that's working with them in the medical office. And so every week or every 2 weeks, you want to get paid. But in order to pay you, they have to have money coming into the organization. All right, so you probably are wondering, well, did you have to pay that $200? No. Why? I said to the clinic, hey, my dad was admitted to the hospital. That's the reason why he could not come. Now, you may be thinking, well, why they charge you so much? Well, it's a cardiologist. Those slots are precious. For specialists, there is always a wait, right? So if you're going to see the lung specialist, if you're going to see the heart specialist, if you're going to see the diabetes doctor, there's not such a thing as you call today and you can go see them today or tomorrow because their schedule is booked. So they have those penalties in place because unfortunately, sometimes patients don't respect our time. And so we have to have policies in place. And so it's important that we tell the patient what our policies are. The other thing that's important to know is we should document in the medical record when those patients are not showing up for those appointments. So in your workbook that you have, they talk about the processes that many offices follow. So the first time they don't show up, they document it in the medical record. The second time they say, hey patient, you are taking a slot for someone else that is trying to see the doctor. And we're warning you that if this continues, there's going to be XYZ that's going to happen after that. The third time, some offices will do what is known as discontinue the patient-provider relationship. So we'll send them a letter via certified mail, and they will say, hey, we can no longer see you as a patient. This is important because you know how sometimes patients are really, really sick, but they don't go to the doctor or they don't comply with the doctor's instructions, and then something happens to them, and then the family tries to blame the doctor, saying the doctor didn't do what they were supposed to do. So we always want to document in the medical record what's going on. Patient is chronically scheduling appointments and they are not showing up. And I don't know about you guys, but I'm seeing more and more offices with fees for no-shows because they want to discourage that behavior. So now there are some things we can do to try to prevent no-shows. So it's 2021, right? We can text them, we can email them. On the CMA exam, and I have to mention this over and over again. You're gonna hear me say this so much. You're gonna say, "Oh, but she stopped saying that." On the CMAA exam, I want you to understand that you're going to answer the questions based on how they have it set up in your workbook. Why? There are not many doctors that are sending you a reminder about your appointment by mail. Why? It costs too much money to send a reminder to a patient by mail. So today, real world, you're going to see, the phone calls, the text messages. My dentist, I have braces. I have been wearing braces for about 4 months. My dentist, when I make an appointment, they send me a text message. A week before my appointment, they send me a text message. Please text back why if you are coming. Then the day before, reminder, you have an appointment tomorrow. The day of, reminder, you have an appointment today at this time. And my dentist, what they're doing right now during this COVID era is they're like, stay in the car, text us when you are here, and then we'll let you know it's okay to come in. So, but for purposes of the CMAA exam, these are the approaches that we can use. We can give them an appointment card. We can have those phone calls that are going in, text messages, etc. Real world, we want to capture when that patient comes to us, how they want us to notify them. So like for me, I tell my doctor, email me, text me, you can call me, because that way, in addition to me putting it, on my phone, I will have multiple ways to remember that I have an appointment. All right, so the next task that a CMAA is going to do, CMAA, I'm going to say that's what you're going to be after all of these sessions are over, Certified Medical Administrative Assistant. One of your roles is arranging a diagnostic test. When you are arranging a diagnostic test, the very first thing that you must have is a written order. That order is going to tell the hospital or the laboratory exactly what your doctor wants and why. Now, with regards to the written order, one of the things that I've seen organizations, kind of struggle with is what's known as medical necessity. So you want a chest x-ray, doctor, but why do you want this chest x-ray? And so the written order, it's our job to make sure that the order shows. I like to call it the who, what, when, where, and why. So, right, the patient's name, their date of birth, what the doctor wants, and why the doctor wants that test. Because when you call the hospital to arrange the test for the patient, they're going to ask you that information. Now, some insurance companies require what is known as a pre-authorization. Pre-authorization is where you call up the insurance company and ask them if the patient can have this service. And guess what? When you call for pre-authorization, they want to know who is it, date of birth. They want to know what test the doctor wants and why. This is one of those things where, and my husband likes to say, it's better to ask for forgiveness instead of approval. That's not the case here. If the insurance company requires pre-authorization, it is so very important that we call and get that service pre-authorized, because we want to make sure that we're going to receive payment for those services, okay? When we are arranging diagnostic tests, we have to have all the information about our patient. We need to know, which facilities their insurance companies say that they can go to. We also need to know our patient's availability. You can't call up and schedule an appointment for a patient at a hospital, but the patient is not available on that day. Because then you got to call the patient back, notify them, and say, hey, we got you scheduled for your such and such test on Wednesday. And the patient's like, oh, I won't be here on Wednesday. I'm going to be in the Bahamas. It's cold in Chicago, and I'm getting out of Chicagoland. I'm not going to be back for a week. So you have to ask the patient if you are responsible for arranging that test when they are available. Day, night, all of that. Certain tests require instructions. So, for example, if you are arranging for the patient to get a mammogram, one of the things they tell you is to not have on any deodorant. So whatever instructions you need to give the patient, you want to make sure that that patient is notified. Certain services will require a consent form. So if the patient is having surgery, a consent form, that process will need to be completed. And last but not least, update this information in the medical record. Now, something that is very important when you are giving the patient instructions, have the patient repeat the information back to you, because if you don't have them repeat the information back to you, you can't confirm that that patient actually understands what you are saying. All right, confirming future appointments. So here, the first thing I want to tell you is HIPAA, the Health Insurance Portability and Accountability Act. When you are calling patients on the phone to remind them of their appointments, you must follow HIPAA guidelines. So if you're on the phone with them, you want to be real loud saying, hey, Mr. Jones, you need to come in for your blood test follow-up. You got chlamydia, and we're going to need to get you scheduled. We're going to need to get you some antibiotics, right? You don't want to do that to Mr. Smith because the whole office can hear you. So you want to say, hello, Mr. Smith. This is Rebecca calling from Dr. Smith's office, and give very little information. Patients will tell us how much information we can share when we call them. But when you call them, you want to limit the information to what is necessary. The reason that patients will tell us what we can say, let's say I'm married. So I am married. But let's say I don't want my husband to know about my blood test. So I may say in the system, you can call my house, but don't leave a voicemail. Well, it's 2021. I don't know who still has a home phone. I don't, but my husband can hear whatever he wants to hear because I have nothing to hide. Other than, my occasional shopping trips. Those I might want to hide. All right, so when we are confirming future appointments, we have to get the patient's approval for how and what we can communicate to them. That is so very important. HIPAA is all about, well, not all about, because HIPAA, we'll talk about HIPAA in a couple of sessions. But one of the aspects of HIPAA is about patient privacy. So please keep that in mind. And I always say, think about, like what you want, what information you want shared. All right. I was tired of standing up, so let me sit back down. All right. So when we're confirming future appointments, one of the things that you want to keep in mind is just because your patient has an insurance card, doesn't mean that the insurance is active. What do I mean by that? When you get a new insurance, they give you this card, right? But when your insurance expires, they don't give you you no longer have insurance card. So when we are confirming appointments, we want to make sure that we confirm the insurance information. That is so very, 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 very important. Confirming that insurance information. So, for example, you want to make sure that this patient can come to your office, okay? Because if their insurance doesn't allow them to come to your office, you need to let them know you can come here, but you are going to have to pay for today's visit. When you are confirming appointments, you also want to let the patient know anything that they owe us. Co-payment. We'll talk about that in another session. But if they have dollar amounts that they owe us, let them know it is due at the time of service. Always ask patients to bring their insurance card, their photo ID. We like to put those into our electronic medical record. If the patient is seeing us and we are a specialist, we may need for them to bring us a referral from their primary care physician saying that it is okay for the patient to be here. It is not better to ask for forgiveness. We want to make sure that we comply with insurance rules and regulations, because if not, we may not get paid. And then we also want to inform the patients of any policies and procedures that we have. All right, so what's next? So in your workbook, you're going to be reading the scheduling chapter. There is some homework that you are going to be completing, and then there's going to be an exam on scheduling. Now, the one thing I want you to know about these exams, you can only take them once. So when I talked about, what's going to be your study plan, your study strategy, you got to think about this because we're going to be covering one topic after the next. So it's going to be lecture, read the chapter in the workbook, complete the homework, take the exam. And so you really want to make sure that you come up with a game plan for how you're going to execute this. All right, so I've been talking literally for 45 minutes. I know that because I have a timer. So I want to pause and I want to find out from you all, what did you just learn? And just like before, I'm going to call on names.